Good day, my name is Paul Jarrett. I'm an orthopaedic surgeon. I look after people who've got problems with their upper limbs. I was wanting to talk to you today about carpal tunnel syndrome, which is a very common problem that people have with their upper limbs. And in fact, 1 in 10 people in their lifetime in Australia will have significant carpal tunnel to the extent that they wish to have treatment for it. In your hand, you've got two main nerves that go to your fingers. You've got the median nerve, and that tends to go to the 3 fingers on your thumb side and half the finger of your ring finger. And then you've got your ulnar nerve, and that goes to your little finger and usually the little finger side of your ring finger. Now, the median nerve that goes to your thumb side of your hand, as it goes from your forearm into your wrist, it passes through a tunnel. So this is the left hand here, and you can see the nerve, and it passes under a ligament before going into the hand. And sometimes within that tunnel, it gets compressed, and that gives people problems with their hand. And typically people will find that they get pins and needles and numbness of these fingers, often pain in that area, sometimes a burning nerve type pain, often with the pain going up the forearm, occasionally even higher up towards your shoulder. Often this pain is much worse at night, and in activities where your wrist is bent for prolonged periods, such as driving the car, on the telephone for a long period of time, reading books for a long period of time as well. Sometimes people will find that their hand becomes less strong, or that they're not so good at fine motor skills, little dexterous tasks. There are a number of different treatments for this condition. So sometimes if it's very, very mild, it requires no treatment at all. So if you have symptoms like that and they're mild and fairly infrequent and not causing you any problems, then probably you don't require any treatment. But the people who come and see us tend to have more significant symptoms, and there are 3 different types of treatment that we tend to offer people. So often we will give people splints to wear at night time, and this can help your night symptoms considerably. And also we'll ask the hand therapist to see you to give you some exercises to help the nerve glide better within your wrist. And you don't think about it, but normally when you're moving, when you're using your arm, lots of structures inside you are moving, such as the tendons, but also your nerves do glide up and down. And in carpal tunnel syndrome, the nerves sometimes get stuck down, more adherent to the surrounding tissues, and so there are exercises that can help it glide better again, and that can improve people's symptoms. Another treatment that we do sometimes is putting injections of steroid around about the nerve. Now, that's much less common to be a long-term solution for the problem. Sometimes it can help resolve carpal tunnel syndrome, but more commonly it helps for a period of time. But it's very useful in people who are likely to get better by themselves. So some people, when they're pregnant, towards the end of their pregnancy, they develop carpal tunnel syndrome. And for most of those people, once they give birth after a period of time, the carpal tunnel symptoms will disappear. And of course, if we give you a steroid injection that works for 2 or 3 months, and it was going to get better over 2 and 3 months anyway, then that's effectively dealt with the problem for you. By far the most effective treatment for carpal tunnel syndrome, and certainly if your symptoms are bad or significant or long term, then a carpal tunnel decompression is a worthwhile thing to consider. And in that operation, all we're doing effectively is dividing this ligament on top of the nerve. The tunnel that the tendons and the nerves go through becomes bigger, and that tendon, that ligament effectively reforms longer than it did before, but takes the pressure off the nerve. And for the vast majority of people, that will get rid of their symptoms. It does depend to a certain extent how bad your symptoms were before, and also your age. So if you're really quite elderly and your symptoms were very bad before your operation, then a lesser percentage of people will get rid of all their symptoms. But particularly people who are younger and people who haven't had the symptoms for too long, often the operation will get rid of all your symptoms completely, and for the vast majority of people, things get very much better than they did before. Of course, it's awkward having an operation. It does have a recovery time. This area of your skin, you don't think about it so much, but you use this all the time when you push up on things, when you're leaning on things, using your hand, often you bump and bang that area, and of course if we put a scar there, it's going to be tender for a period of time. Then you'll also find after an operation that your hand becomes less useful for a period of time. So after 2 or 3 days, you really don't have particularly good function of your hand. You can use it for what you feel comfortable with, but it's not so good. And day by day, things tend to get better and better. On average, people feel that they've got enough comfort, strength, and function to drive safely around about a week. Of course, that's entirely up to you when you feel you've got the capacity to drive safely. We don't like you getting the wound wet for 10 days afterwards, and usually by a couple of weeks most people can find most everyday activities are managing fairly well, and by about a month most people are finding heavy things possible again. But it does take a number of months to recover maximally, for all the tenderness to get as good as it's going to get, and for your strength to improve maximally. There is, after your operation, we put a dressing on and 2 layers of bandages, and after 2 days of bandages both layers can come off, just leaving the sticky plaster on, and in 10 days you can take the sticky plaster off and then start massaging and moisturizing your hand. And Emma, the nurse who works with us, has got a separate video on how to take your bandages off and how to massage your wound, which you can find on our website. There are some risks behind having an operation, and the most significant risks are infection to the wound, which is usually about 1 in 200 risk for people who don't have diabetes, and about 1 in 100 of people who do have diabetes. There is a risk of injuring structures in there, and the most structure that we worry about the most is the nerve, and that is very unlikely for that to happen, but of course can happen. And there's a chance of your symptoms coming back with time. It's really quite uncommon, and particularly uncommon to require further treatment for it, but usually if your symptoms come back they're really quite mild and don't require treatment, although it is possible. There's a condition called complex regional pain syndrome, where your hand can get much more uncomfortable and take an awful lot longer to get better or not recover completely, and again this is really very rare indeed. So for most people with carpal tunnel syndrome, it is possible to have treatment to make things considerably better, and certainly if your symptoms are very bad, an operation is the most involved. You're welcome to look at my website. There's information on that, and if you come to see us we'll give you a patient information book, and of course we'd be delighted to see you at the clinic appointment. Thank you.